Afternoon. My name is Dr. Hussain. I am one of the medical directors at Skin London Clinics, and I'm also an honorary lecturer at Queen Mary University of London. And this video today is for the benefit of my students at Queen Mary University of London. We often talk about the necessity to aspirate before we inject hyaluronic acid fillers. Now, injecting very often Vicross Juvederm fillers, find that it is reasonably often that I will aspirate some blood before I inject, in which case I move the position of my needle and I re-inject, re-aspirate and re-inject. But I have been noting that there are conflicting views on the need for aspiration. Some people have mentioned to me that due to the viscous nature of some fillers, it is difficult to aspirate and tell whether you are indeed in a vein or in an artery, and that the aspiration possibility varies on product. In answer to this, there's not been much direct work done, I guess, to elicit the point. So there is a great deal of confusion in the matter, from what I see. So effectively, what I've decided to do today is just do a product-specific test to see if aspiration does indeed work as a concept. So effectively, we've taken two volunteers from my clinic who are Rhoda and Shireen, and they have very kindly volunteered to be test dummies for, no, I didn't mean test dummies, that was a bad one. Test victims.
Guinea pigs.
Guinea pigs, that's it. Aspiration test with Juvederm Smile. So what I'm going to do is just penetrate the vein with the needle. Thank you. And let's see if we can aspirate some blood. And as you can see, we're getting some blood into the hub. Let's see if we can get a little bit more. So that was with Juvederm Smile, and we have a little bit of blood in the hub, as we can see. All right, perfect. So here we're repeating the same experiment with Volift, Juvederm Volift. So I'm just going to penetrate the vein. Well done there, Rhoda. And as you can see, we have a really nice, decent quantity of venous blood there. So that is a good conclusion to our experiment. Perfect. So I've been thinking a little bit about our earlier experiment today back in clinic. Effectively, we had two fillers, Juvederm Smile, which is part of the Hyalocross Juvederm Ultra range, and Juvederm Volift, which is part of the Vicross range. Now, we used, in each case, the same cross-sectional area of syringe, and the needle was a 30 gauge half-inch needle in both cases. So those things were consistent in the test. Effectively, we can assume that the sort of the mean vascular pressure in a vein is around about 15 millimeters of mercury. And looking at the results of both tests, what we can see is that with Juvederm Smile, we find that there is a small, barely visible quantity of blood in the hub of the needle. So aspiration in this syringe of Juvederm Smile was relatively poor or minimal or barely visible. However, in the Juvederm Volift syringe, there was a very easy aspiration of quite a large quantity of blood, as we could see at the end of the test. Now, what does this mean? Well, effectively, it is clear that you can aspirate blood with a filler, but depending on the type of filler used and perhaps other parameters, it may be difficult or barely possible or extremely possible to aspirate blood. Okay, so we're now going to think a little bit more about the science of aspiration, let's call it, or looking how this technique is effective. If we think about it, if we compare Juvederm Ultra or Juvederm Smile to Juvederm Volift, Juvederm Smile has different viscoelastic properties to Juvederm Volift. Juvederm Smile is a more viscous product, and it also has a greater cohesivity than Juvederm Volift. As a result, the resistance to flow in Juvederm Smile is greater. Now, for a consistent syringe needle setup, which is what we had in both cases, when we try to aspirate in Juvederm Smile, the pressure we generate in pulling the plunger back is not enough to overcome the resistance to flow from the filler itself. Hence, a cavitation bubble is created within the syringe, and filler that resists flow still blocks the path of blood into the hub of the needle. Effectively, this story is different with Volift. With Volift, we have a less cohesive, less viscous filler. And with Volift, what's actually happening is that when we pull back on the syringe, because there's relatively minimal resistance to flow, the filler is sort of taken back out of the needle itself, and the pressure of the blood in the vessel can then allow the blood to pass into the actual hub of the syringe. And this is why we're getting blood, a nice aspirated quantity of blood in the Volift syringe. So in short, there are three things to consider when aspirating. So those three things that we would need to consider when it comes to aspiration of filler are the following. Firstly, the flow characteristics of the filler, the viscosity and the cohesivity of the filler will affect how easy it is to aspirate with that filler. And obviously, there are multiple different brands of filler on the market, and with each of these brands there are several different sub-products in the range. So it's impossible with this simple experiment to answer how possible it will be to aspirate with all the different types of filler on the market. You can already see with one single brand, such as Juvederm, 2 fillers within that brand have different aspiration properties. One is easy to aspirate blood with, the other is very difficult to aspirate blood with. Secondly, the length of the needle, the gauge of the needle, and the cross-sectional area of the syringe also affect how easy it is to aspirate. So if we're using a long, thin 27 gauge cannula attached to the standard sort of filler syringe, it's going to be virtually impossible due to the increased resistance caused by the caliber and length of the actual cannula to aspirate blood. So the actual tools we're using in terms of the syringe, the type of needle attached to the syringe, or the cannula attached to the syringe, all affect the state of play when it comes to aspiration. In fact, obviously if we use a large bore needle, suppose we change to a 27 gauge needle or a 21 gauge needle with the filler, with Juvederm Smile, it may have been indeed possible to aspirate blood into the needle. But remember, I suppose it makes sense in this case that we should try and assess fillers with the standard types of needles that we would use with them. So for example, Juvederm Smile comes with a 30 gauge, so this was what was used, and Volift comes with a 30 gauge, so this was what was used. Finally, the third thing that is important when considering aspiration is probably the fact that the vessel that you are actually aspirating from may have something to contribute to how easy it is to aspirate from. So a larger vessel with a higher mean pressure within it, perhaps an artery for example, would be easier to aspirate from than a small caliber vessel, such as a vein with a lower mean pressure, which would probably be more difficult to aspirate from, especially because if the negative pressure induced in the vessel causes the vessel to collapse, it may indeed be impossible to aspirate from the vessel. So those are the three things that you must consider when it comes to aspiration. In short, the take-home message is that yes, you can aspirate with a filler syringe. However, is this a foolproof tool for assessing safety of placement of filler? It most certainly isn't. It depends on the filler, it depends on a multitude of different things that we've just discussed. So one person using one brand of filler may not have the same capability of aspirating as someone using a different brand of filler or a different needle syringe setup. So we cannot rely on aspiration as a foolproof technique, but it is possible. Thank you for this sort of listening to this simple assessment of aspiration with fillers. Thank you.